Thank you, Mr. Chairman. I appreciate that. Ms. Eshoo talked about the need to provide comprehensive mental health coverage for healthcare workers. It's interesting that this week in the Richmond Times-Dispatch, that would be February 12th, and I'm just going to read you the first two paragraphs. Dr. Trudy Shahady was feeling burned out. It was during the height of the pandemic, and 3 unvaccinated patients had died of COVID-19 in the span of 1 week. She needed help, she decided, so she called a program that existed nowhere else in the country, one that allows doctors to seek therapy without putting their careers in jeopardy. This was a Virginia program Virginia has been leading, and one of the programs they implemented was a secure subscription portal that healthcare workers can buy into. This program allows health workers to seek discreet therapy without a fear that they will lose their jobs, or the mere fact that they called in and asked for help and got help would be used against them in every single malpractice case brought up after that point. But with protocols in place, the program had protocols in place for reporting certain instances. Over 8,000 workers in Virginia have taken advantage of this program. Mr. Feist, what more can be done on top of reauthorizing these important programs at the federal level, but won't hamper what the states are trying to do? Because obviously states are innovative sometimes.
States are innovative, and let me go beyond what Virginia's doing just to highlight it for the committee, because Virginia really is leading the country. No pressure on your other states, by the way. Their goal in Virginia is to be the best place to take care of healthcare, to take care of patients. And so the program you're speaking of is the Medical Society of Virginia's Champion Safe Haven program. Last year, the Virginia governor signed a new law into place which puts every single licensed health worker in 62 different health professions. That's 500,000 licensed health workers in Virginia now no longer have questions on their licensing applications that talk about their prior mental health treatment or diagnosis. This change that Virginia made, as I said, is benefiting 500,000 health workers, and that is the kind of leadership that we need to see across the country when it comes to one of the 2 top barriers to accessing mental health care that healthcare workers have. The first is your license. The second is when you go to work for a hospital and your credentials. Ms. Eshoo pointed out that there's over 6,000 hospitals in this country. Well, in the last year, in addition to changing the law in Virginia, 75% of the hospitals removed their questions from their credentialing application. That's when you go to work at a hospital. You need to be able to answer these questions, and they're often overly invasive and drive this stigma. So what we're trying to do is get at the primary cause of suicide of health workers, and that's what others can do, is to really very, very artfully just take a look at those questions that you are asking of your health workers and recognize that in those questions, you are creating structural stigma that drives suicide, prevents mental health treatment, and is one very important way that your healthcare workers can feel valued and supported.
And the article also touches on the high rates of suicide amongst our healthcare workers. Mr. Chairman, I know the other side hadn't seen it, so I'm happy for it to be reviewed, but I would like to have that article from the Richmond Times-Dispatch entered into the record if there's no objection, but I'll give them a chance to take a look at it first. We'll pass that on down.
Without objection.
I'll now move to Mr. Strozek. Thank you so much, Mr. Feist. Calls to the poison centers across the country increased by 82% from 2021 to 2022. In 2022 alone in Virginia, there were more than 1,200 calls into poison centers for THC-related incidences. I have legislation that would attempt to create a regulatory framework for these products because the FDA has dragged their feet in addressing these products, leaving it to be kind of like the Wild West out there, and it affects children, it affects others, but it particularly is affecting young people who buy this stuff at the convenience store and think it's like candy because it comes in gummies. Have you had experience with your ambulances being called to address CBD issues?
We have had issues and calls related to that. Specifically, you raise a very good point about the issuance of candy, alternative administration of THC. This has grown. Mom and dad have it at home. The young child gets it. It's unknown. It's not regulated necessarily in terms of dosages. Equally true is these modified medications or modified therapeutics that you find at 7-Eleven or whatever, and in some cases these have adverse effects. In the state of Washington, I believe 2 years ago, a gentleman overconsumed, and I can't name the product, He went out, they were later on shot 2 people. It was an incredibly tragic event. And yet these things are not protected. They're on the counter. They're not age regulated. And we have seen an increase of effects by these.
Yeah, I appreciate it. My time is up. I've got lots of other questions I'll submit for the record, but I yield back.